Hi, I'm Dr. Sofia Khan, the Medical Director and Chair of the Emergency Department. Today I want to spend a little time with you talking about what to expect when you come to the Emergency Department at DeKalb Regional Health System. If you come in through the front door, the first process you're going to go through is something called triage. Triage is where a nurse will assess you and understand what your chief complaint is. This is the main reason you are coming to the Emergency Department. The triage nurse will take your vital signs. The vital signs include your heart rate, your blood pressure, your oxygen level, and even your temperature. These 4 key measurements help to tell us just how sick you are. Based on your severity, you'll be placed on a list. This list will determine when you will be able to be seen by a physician or an advanced provider, which is a physician assistant or a nurse practitioner. If you are waiting and a room is not available, we're still going to be continuing your care. You'll get blood work that's necessary, x-rays that are necessary. So while you're waiting, your test results are being processed. Once a room is available, the physician will come in, see you, ask you several other questions. Now remember, we may ask you the same questions. The reason why we're doing this is because we want to make sure that we're not missing anything and that we're taking the very best care of you. It may seem at times that nothing is happening, and we understand that that can be frustrating, but that's not true. While you're waiting, either in the waiting room or in your room, your physician is reviewing your results, perhaps discussing your case with a consultant or looking at older records. The point is, your care never stops at DeKalb. During this process, the physician will be able to determine what your diagnosis is. Here's the best part. While you were waiting in the waiting room and all your labs and x-rays were being obtained, that processing time that you waited for will be cut short because now when the physician sees you, all of those results will be ready for his or her review. Many people ask me when you're supposed to go to the emergency department, when you're supposed to go to the urgent care department, and when you're supposed to go to the primary care facility. I encourage you to visit our website where a team of nurses, physicians, and healthcare personnel have put together a comprehensive list of when to go to the emergency department, when to see an urgent care center, and when to see your primary care visit. Here's one more thing I'd like to talk to you about. Have you ever been in an emergency department and noticed that 3 or 4 people are being treated or being taken back sooner than you are? At DeKalb Medical, we have a fast-track area that is specifically designed for patients who have lower acuity concerns. What do I mean by lower acuity? You're coming in with a cold. Maybe you've got an ankle sprain. But if your concern is greater, like chest pain, we may need to keep you for longer and do more comprehensive and intensive tests. That's what leads to a longer wait time and also leads us to making sure that we can see you in a place that's safe and fit to take care of you. So the last part I want to speak to you about is your discharge process. This is perhaps one of the most critical processes of the emergency department. This is where the provider is saying you are safe to go home. But the instructions you will get, the prescriptions you will get will be very important. This is the time to ask questions. Studies have shown that when patients are engaged in their care with their providers, that the best healthcare outcomes are achieved. We're with you all the way.